This is Dr. Shana Clark, and this is episode 3 of Ask Dr. Clark. Um, I said I was going to start on depression today, but there are a couple of things I should mention first. One is many people do not believe they have any control over their own thoughts. In other words, if they wake up in the morning and they have a very depressing thought comes to them, they don't feel there's anything they can do about it other than wait for the thought to go away, and they don't think they can just tell their thought, I'm sorry, but I don't want to dialogue with you right now. This is the wrong time. And the thought might say, well, who do you think you are? And the answer is, I am your boss. I am the person that owns your mind. And you can actually train your thoughts not to present you with something very depressing first thing in the morning. Let's say that you are looking for a job, which I know in today's economy, most people who want to be working are already, but I think many of you might know what that is like. And let us say you have applied for 4 different jobs and that you found out late yesterday that you have not been chosen for any of them. The key thing here is you applied for 4 jobs and have not succeeded yet is fact. But you have to keep your mind from jumping to, well, I didn't get those 4 jobs, I'll never get a job. Because the tendency to see a difficulty as permanent, as global, as meaning nothing will ever change and everything will always be against you is a hallmark of real need to see a psychiatrist. Depression. People may be turned down for a great many jobs, and some of them are able to say, well, I just haven't found the place for me yet. Those people are still hopeful that they will, and therefore they may be discouraged, but they're not badly depressed. The person who says, I haven't gotten any one of those 4 jobs, I'll never get a job, I'm done for, I might as well be dead, you can see where that's going. And a key to managing depression or a tendency toward depression is to keep your mind from going to the end of the line in terms of thinking, I might as well be dead. Because the next step after that is the thought that I could make myself dead, which means I could attempt suicide. And once you start thinking that way, it's very difficult to come back and say, wait a minute, this is a temporary setback. There is no question that bad things happen in life. Anybody who's had a close family member die knows that. But there is also no question that there is life after thoughts of death for everybody. I'm being careful here because I happen to be a person who has religious faith, and I believe there is life after death for everybody, but that's a different subject. And since I know a great many people do not agree with me there, I'm not going to discuss that here. But the thing is, you have to train yourself to stay away from the extremely negative interpretation of events. You applied for and did not get hired for 4 jobs. Don't make that a huge problem in your mind. Don't allow that to become a huge problem. Now, you can also say that some people who are having trouble finding a job, they need a course in how to state their resume, or they may need a course in the technique of presenting oneself for a job interview, because it's quite different from other interactions with other people. And you have to develop an ability to give yourself praise that is in your mind justified and can be backed up by the facts without sounding like somebody with a monstrous ego. On the other hand, you certainly don't want to come over to an prospective employer as having the attitude that you don't know how to do a lot of things associated with the job. So you really have to, in saying no to your mind, saying, oh, you want me to think about my 4 possible job losses. Well, I want to think about the job that I'm going to apply for today. And since I'm the boss and I own my own mind, that's what I'm going to think about. Now, problem comes when your mind has never been disciplined to obey your dictates and do what you say. And so you may have quite a problem on your hands. A lot of people treat their mind as if it were an unruly, totally undisciplined 3-year-old, and they're just stuck with whatever the 3-year-old does. Instead of saying, you're a 3-year-old, I'm growing up, I'm grown up, and you may say or do what you wish, but I'm not going to obey you. You are going to obey me. It may take some time to be able to do this, but let me tell you, it is not only possible, it is something that people who progress in the world have started, have at least started to learn to do. So if your mind presents you with something negative, have an alternative. If you don't have something that you need to think about right away, have some positive activity that you have enjoyed before and start doing that. It has been pointed out that things that have to do with using your hands may be particularly useful. Things such as gardening, sewing, cooking, uh, woodworking, any kind of hand involving craft. And if you have something that you do that you already enjoy, make sure that you have everything necessary to do this readily available so you can get working on your woodworking and be thinking about how to make the wood that you have be in the shape you want it to be. Also, for women, if you particularly enjoy sewing or embroidery, make sure you always have the thread and the cloth, and that you can just pick up and get involved in something which will get your mind off the very negative thinking. Um, if you're having depressing thoughts, the best way to tackle getting out of them is right away so that they don't get really plugged into your mind, because people can be depressed for months because they don't know how to get rid of that depressive outlook. Now, the second thing I'm going to tackle for today is the idea that people frequently say, "Oh, I'm depressed," when what they mean is that they're discouraged. I think this is an important distinction because, in my mind, a person who is depressed needs professional help, whereas a person who is merely discouraged maybe could listen to some music they enjoy for a little while, or call a friend, or go out and walk around, or go do their grocery shopping, or something like that, and get away from the discouragement. It's partly, at least, a matter of degree, but don't let yourself ever fall into the nothing will ever improve. I won't ever get better. Things will never change for me. Because once that thought is firmly anchored into your mind, it can be extremely difficult to chase it out. Um, okay, next week we'll start discussing depression as a mental illness. Okay, so by the way, if you have any question for me, I'll say again, go on to YouTube, or actually go on to my website, which is DOCTOR Shana, SHANA.net, and send me a communication with a question, and I will try to answer the question in an upcoming video. So I don't quite have a call-in show, but this is the closest that I can come. Besides, it gives me a few days to think over how I'm going to phrase my answer. I will say once again that I will not recommend a particular form of therapy, which some people call counseling, or a particular medication, because after one or two interactions, I don't know you nearly as well as your providers do. But if you are having difficulty conveying to your provider in a way that he or she will listen something about a particular side effect or a particular difficulty you're having, I'd love to help you out with communication side of things. So, I hope to see you again next week, and um, try and practice staying away from negative thoughts in the meantime. Okay, until next week. Bye bye.